Imagine the doctor diagnoses you with a serious illness, but doesn't tell you how serious it is. You don't understand how it was transmitted. You don't know how to manage the infection. You don't know what treatments are available. And this can happen a lot, especially for those of us in the community who have chronic hepatitis B. And as you might imagine, it can discourage people from asking medical professionals for help. Well, today, this podcast is led by May.
Hi, I'm May, mother of teenagers, and I'm a hepatitis B advocate.
And Gab.
I'm Gab. I'm a nurse at St Vincents and the Victorian Hepatitis educator.
May and Gab have been working together through the Hepatitis B Alliance.
May is helping us to get the message out to health workers about how important hepatitis B is and how to care better for people with hepatitis B.
May and Gab are going to present the podcast today in collaboration between the Victorian Hepatitis B Alliance and NRCH. So please enjoy.
So, May, can you tell us a little bit about your journey and how you found out that you had hepatitis B?
It is through a visit to my GP via a simple blood test.
Mm-hmm.
The doctor said that I'm a carrier.
Right. So that's interesting. The doctor said you're a carrier. That's a word we try to avoid. When someone lives with the chronic hepatitis B infection, it's really important that they have checkups every 6 to 12 months. Then we can usually prevent serious complications.
So the doctor seems to be more concerned of my, back pains and acne or asthma, but not hepatitis B. So
Okay.
from then on, I'll just have the regular yearly check. Yes, so that's that. And another experience sharing with one person, and the comment was, did you have AIDS, May, And so that gave me like a bit of a shock, and I just felt speechless.
So there was some confusion between Hep B and AIDS for that person.
I guess so.
So what information did you receive from the doctor when you got diagnosed?
Not much. The doctor didn't explain it was chronic, and he didn't explain much, and I didn't receive much information.
Okay. So how did you understand hepatitis B then?
In my mind, I have it, and it's just sitting there. I'm just carrying the disease, but I wasn't concerned because my doctor wasn't concerned at all. But now I do. I know that it is serious.
And so now that you're a hepatitis B advocate, what has changed and motivated you to share your journey with other people?
Of course, being a volunteer and advocate at LiverWell and hearing a lot of stories from other community members, I just felt that there's really a need to share more of my story, my journey, to help others. I just see the need there to do more.
And so what support have you received along the way from health workers or family, friends?
My doctor would explain to me my results and all is well, and we'll see you in 6 months, May. So just like that, but not much of a explain of what it is or how are you emotionally and things like that. We really haven't, not sure whether there's no time to talk about it, but my family members, they do check on me, and they know that I'm going to the appointments and follow-up check to say, what did the doctors, what are results and how are you, and, how are you going? Are you okay? As well as that I'm connected with LiverWell there. And when we do catch up, we do talk about our journey as well. So that's also a help, in the like-minded. So just a space to talk about it freely and with no judgment, but support.
Yeah.
Yeah.
Okay. What do you think people living with Hep B need in terms of receiving good health care?
Well, my opinion, like to see the health side of things or Victorian Health to provide a hepatitis B nurse to coordinate hepatitis B health, because doctors are busy, and hopefully nurses can, take up the time to explain and answer further questions, after the visit to the specialist or our GPs, and to have the hepatitis B education sessions in different languages, especially for mothers.
And what would you like to tell healthcare providers about how to provide good care for people with hepatitis B?
I would say to tell the patient it's serious and it can cause liver cancer, and to provide more information on what hepatitis is, perhaps on leaflets or the education sessions that I just mentioned previous. Also to let them know that the importance of regular checkups, explain different phases of hepatitis B, from normal to getting bad and getting worse. Sometimes for patients to see how liver disease and liver cancer, to see the picture, I think that's when people click and take it serious and to really take more care of themselves. Also to advise on more sleep, exercise, limit on drinking alcohol and to avoid fatty food. Another important thing the health providers can do is to be kind, compassionate, and take time to explain things, in an easy, plain English language so all can understand. As we know, many people are from different cultural background.
Very important. And what advice would you give to someone who's just newly diagnosed with hepatitis B?
Well, I would say be brave and be open. Not to be ashamed of having hepatitis B. Seek help early. Hepatitis B is just like any other health condition, like when you broke a leg or when you have diabetes, you go and see your doctor, right? And you talk about it and you seek help. So that's the same for hepatitis B. Look after yourself and see your GP. If that GP is not helpful, find another one. Connect with hepatitis B organisations for support, and hopefully information is available in other languages as well. Yeah.
Mm-hmm. And what advice would you give to a healthcare provider who's looking after someone with hepatitis B?
Once again, to be kind and patient and show understanding, and check in on them that they understand their status and their liver health and its seriousness as well. Show some kind of systems for following up, and show that you care and build trust and compassion. Don't discriminate or stigmatize.
And May, has COVID-19 had an impact on any of your hepatitis B care?
No, I was still able to, do blood tests and ultrasound safely during the, 2020 or 2021 that we had. I myself also prioritized my health so that I can take care of my parents, my children, and my family. Yeah, I really don't want to die, of liver cancer. My mum passed away. I think we heard it's like stomach cancer, but we don't know whether it could be hepatitis B, liver cancer. I would like to share that for everyone to hear this is to love yourself enough and to take care of yourself.
Very important message. Thank you, May, for being so brave and courageous and sharing your journey with us all.
You're welcome. Thank you.